Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuy.com. This is 25 practice NCLEX questions. Without the way, let's get started.
The client diagnosed with type 1 diabetes is reporting a dry mouth, extreme thirst, and increased urination. Which interventions should the nurse implement? Select all that apply. 1. Administer 1 amp of IV 50% glucose. 2. Prepare to administer IV regular insulin. 3. Inject insulin isophane subcutaneously in the abdomen. 4. Hang an IV infusion of D5W at a keep open rate. 5. Check the client's blood glucose level via a glucometer. The correct answers are 2. Prepare to administer IV regular insulin, and 5. Check the client's blood glucose level via a glucometer. The client's signs and symptoms indicate the client is experiencing diabetic ketoacidosis, which is treated with IV regular insulin. These are signs, symptoms of DKA. Therefore, checking the client's blood glucose level is an appropriate intervention. 1 amp of 50% glucose would be used to treat a severe hypoglycemic reaction, and this client does not have signs or symptoms that indicate hypoglycemia. In fact, the client has signs and symptoms of hyperglycemia. Insulin isophane is an intermediate-acting insulin which is not used to treat hyperglycemia. An IV of D5W would cause the client to have further signs and symptoms of DKA. Therefore, the nurse should not administer the IV. The nurse in the medical department is preparing to administer insulin Lispro to a client diagnosed with type 1 diabetes. Which intervention should the nurse implement? 1. Ensure the client is wearing a Medic Alert bracelet. 2. Administer the dose according to the regular insulin sliding scale. 3. Assess the client for hyperosmolar, hyperglycemic, non-ketotic coma. 4. Make sure the client eats the food on the meal tray that is at the bedside. The correct answer is 4. Make sure the client eats the food on the meal tray that is at the bedside. Insulin Lispro peaks in 30 minutes to 1 hour. Therefore, the client needs to eat when or shortly after the medication is administered to prevent hypoglycemia. Because the client is in the hospital, the client must have a hospital identification band. A Medic Alert bracelet would be needed when the client is not in the hospital. Insulin Lispro is not regular insulin, it is fast-acting insulin. It is not administered according to the regular insulin sliding scale. The peak time for insulin Lispro is 30 minutes to 1 hour. Regular insulin peaks in 2 to 4 hours. A client with type 1 diabetes will experience DKA. A client with type 2 diabetes will experience hyperosmolar, hyperglycemic, non-ketotic coma. The nurse is discussing storage of insulin vials with the client. Which statement indicates the client understands the teaching concerning the storage of insulin? 1. I will keep my unopened vials of insulin in the refrigerator. 2. I can keep my insulin in the trunk of my car, so I will have it at all times. 3. It is all right to put my unopened insulin vials in the freezer. 4. If I pre-fill my insulin syringes, I must use them within 1 to 2 days. The correct answer is 1. I will keep my unopened vials of insulin in the refrigerator. This statement indicates the client understands the medication teaching. Keeping the insulin in the refrigerator will maintain the insulin's strength and potency. Once the insulin vial is opened, it may be kept at room temperature for 1 month. Insulin vials should not be placed in direct sunlight or in a high-temperature area, such as the trunk of a car, because it will lose its strength. Insulin should not be kept in the freezer because freezing will cause the insulin to break down and lose its effectiveness. Pre-filled syringes should be stored in the refrigerator and should be used within 1 to 2 weeks, not 1 to 2 days. The client diagnosed with type 2 diabetes is prescribed the medication glipizide. Which statement by the client warrants intervention by the nurse? 1. I have to eat my diabetic diet even if I am taking this medication. 2. I will need to check my blood glucose level at least once a day. 3. I usually have 1 glass of wine with my evening meal. 4. I do not like to walk every day, but I will if it will help my diabetes. The correct answer is 3. I usually have 1 glass of wine with my evening meal. Glipizide is a sulfonylurea which stimulates the pancreatitis to secrete more insulin. Sulfonylureas and biguanides may cause an antabuse-like reaction when taken with alcohol, causing the client to become nauseated and vomit. Advise the client to abstain from alcohol and to avoid liquid over-the-counter medications that may contain alcohol. Alcohol also increases the half-life of the medication and can cause a hypoglycemic reaction. The client with type 2 diabetes does not need to walk daily to keep the glucose level within normal limits. Walking 3 times a week will help control stress and help decrease weight if the client is overweight. The client with type 2 diabetes must adhere to the prescribed diet to help keep the blood glucose level within the normal range. Delaying or missing a meal can cause hypoglycemia. The statement in option 1 would not warrant intervention by the nurse. The client should check blood glucose levels to determine if the medication is effective. Therefore, the statement in option 2 would not warrant intervention by the nurse.
Identify the nursing intervention that reflects tertiary healthcare delivery. Select all that apply. 1. Providing emotional support to family members after the death of a relative. 2. Teaching a client how to use a wheelchair after a stroke. 3. Implementing a prescribed hemodialysis treatment. 4. Administering an influenza vaccine. 5. Changing a dressing after surgery. The correct answers are 1. Providing emotional support to family members after the death of a relative. 2. Teaching a client how to use a wheelchair after a stroke. And 3. Implementing a prescribed hemodialysis treatment. Rationale. Providing bereavement services is an example of a tertiary healthcare service. Tertiary care is associated with rehabilitation, long-term care, and care of the dying. Healthcare delivery includes primary, secondary, and tertiary care. Teaching a client how to use a wheelchair after a stroke is an example of a tertiary healthcare service. Tertiary services provide care related to rehabilitation. Implementing a prescribed hemodialysis treatment is an example of tertiary healthcare. Tertiary healthcare includes providing palliative care and supporting comfort and quality of life, as well as maximizing abilities in light of chronic or irreversible conditions. Immunizations are an example of primary, not tertiary, healthcare delivery. Primary healthcare is concerned with promoting health, preventing disease, and providing environmental protection and health education. Changing a dressing after surgery is care associated with the secondary, not tertiary, level of healthcare delivery. Secondary healthcare is associated with acute care, complex diagnosis and treatment of disease and illness, and emergency care.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A client with major depression and psychotic features is admitted involuntarily to the hospital. He will not eat because his bowels have turned to jelly, which the client states is punishment for his wickedness. The client requests to leave the hospital. The nurse denies the request because commitment papers have been initiated by the primary healthcare provider. Which of the following should the nurse identify as a criterion for the client to be legally committable? 1. Evidence of psychosis. 2. Being gravely disabled. 3. Risk of harm to self or others. 4. Diagnosis of mental illness. The correct answer is 2. Being gravely disabled. Rationale. Criteria for commitment include being gravely disabled and posing a harm to self or others. This client is not threatening to harm himself or to harm others. The client is gravely disabled because of his inability to care for himself, namely, not eating because of his delusion. Evidence of psychosis or psychotic symptoms or diagnosis of a mental illness alone does not make the client legally eligible for commitment.
After the nurse receives a change of shift report, which patient should be seen first? 1. A 26-year-old patient with thalassemia who has a hemoglobin level of 8 grams per deciliter and orders for a blood transfusion. 2. A 44-year-old patient admitted 3 days previously for sickle cell crisis who is scheduled for a computed tomographic scan. 3. A 50-year-old patient with stage 4 non-Hodgkin lymphoma who is crying and saying, "I'm not ready to die." 4. A 69-year-old patient with chemotherapy-induced neutropenia who has an oral temperature of 100.1 degrees Fahrenheit. The correct answer is 4. A 69-year-old patient with chemotherapy-induced neutropenia who has an oral temperature of 100.1 degrees Fahrenheit. Any temperature elevation in a neutropenic patient may indicate the presence of a life-threatening infection, so actions such as drawing blood for culture and administering antibiotics should be initiated quickly. The other patients need to be assessed as soon as possible, but are not critically ill. A client has been placed on long-term sulfasalazine therapy for treatment of ulcerative colitis. The nurse should encourage the client to eat which of the following foods to help avoid the nutrient deficiencies that may develop as a result of this medication. 1. Citrus fruits. 2. Green leafy vegetables. 3. Eggs. 4. Milk products. The correct answer is 2. Green leafy vegetables. In long-term sulfasalazine therapy, the client may develop folic acid deficiency. The client can take folic acid supplements, but the nurse should also encourage the client to increase the intake of folic acid in his diet. Green leafy vegetables are a good source of folic acid. Citrus fruits, eggs, and milk products are not good sources of folic acid.
Which laboratory results would the nurse check to determine if there are untoward effects associated with vomiting, nasogastric suction, or lavage? 1. White blood cell counts. 2. Hematocrit and hemoglobin. 3. Serum electrolytes. 4. Blood urea nitrogen and serum creatinine. The correct answer is 3. Serum electrolytes. Rationale. The nurse monitors all laboratory results, but vomiting, nasogastric suction, and lavage can cause fluid and electrolyte imbalances. Fluid loss can cause hemoconcentration and artificially elevated levels for hematocrit, hemoglobin, and blood urea nitrogen. Blood urea nitrogen is generally more affected by fluid loss than serum creatinine. The WBC count could be elevated because of stress, inflammation, or infection.
Which of the following symptoms should the nurse teach the client with unstable angina to report immediately to the physician? 1. A change in the pattern of the chest pain. 2. Pain during sexual activity. 3. Pain during an argument. 4. Pain during or after a physical activity. The correct answer is 1. A change in the pattern of the chest pain. Rationale. The client should report a change in the pattern of chest pain. It may indicate increasing severity of coronary artery disease. Pain occurring during stress or sexual activity would not be unexpected, and the client may be instructed to take nitroglycerin to prevent this pain. Pain during or after an activity, such as lawn mowing, also would not be unexpected. The client may be instructed to take nitroglycerin to prevent this pain or may be restricted from doing such activities.
A nurse is considering the faith development theory by James Fowler while assessing several clients. Which clients does the nurse expect to assume responsibility for their own beliefs about faith? 1. Older adolescents. 2. Young adolescents. 3. Older school-age children. 4. Young school-age children. The correct answer is 1. Older adolescents. Rationale. Older adolescents and young adults assume responsibility for their own commitments, beliefs, and attitudes about faith. This reflects the individuative reflective stage of faith development.
The nurse is taking a report on an older patient who was admitted with abdominal pain, nausea, vomiting, and diarrhea. The patient also has a history of chronic dementia. Which comment by the night shift nurse is most concerning? 1. The patient has a flat effect in rambling and repetitive speech. 2. The patient has memory impairments and thinks the year is 1948. 3. The patient lacks motivation and demonstrates early morning awakening. 4. The patient has a fluctuating level of consciousness and mood swings. The correct answer is 4. The patient has a fluctuating level of consciousness and mood swings. Rationale. A fluctuating level of consciousness and mood swings are associated more with acute delirium, which could be caused by many things, such as electrolyte imbalances, sepsis, or medications. Information about the patient's baseline behavior is essential. However, based on knowledge of pathophysiology, the nurse knows that flat affect in rambling and repetitive speech, memory impairments, and disorientation to time are behaviors typically associated with chronic dementia. Lack of motivation and early morning awakening are associated with depression. A sudden change in the level of consciousness and mental status of a patient signals a need to conduct further assessment for an acute process. This question requires the ability to differentiate between acute and chronic disease processes and accompanying symptoms.
A client has a throbbing headache when nitroglycerin is taken for angina. The nurse should instruct the client that 1. Acetaminophen, Tylenol, or ibuprofen, Advil can be taken for this common side effect. 2. Nitroglycerin should be avoided if the client is experiencing this serious side effect. 3. Taking the nitroglycerin with a few glasses of water will reduce the problem. 4. The client should lie in a supine position to alleviate the headache. The correct answer is 1. Acetaminophen, Tylenol, or ibuprofen, Advil can be taken for this common side effect. Rationale. Headache is a common side effect of nitroglycerin that can be alleviated with aspirin, acetaminophen, or ibuprofen. The sublingual nitroglycerin needs to be absorbed in the mouth, which will be disrupted with drinking. Lying flat will increase blood flow to the head and may increase pain and exacerbate other symptoms, such as shortness of breath.
A nurse is caring for a client who is exposed to a stressful event. Which statement about the general adaptation syndrome should the nurse consider when caring for this client? 1. A stressful event is an iatrogenic stress. 2. An individual exposed to a stressful event will adapt in a unique way. 3. A stressful event will precipitate an autonomic nervous system response. 4. An individual exposed to a stressful event eventually will achieve homeostasis. The correct answer is 3. A stressful event will precipitate an autonomic nervous system response. Rationale. Stressors precipitate the general adaptation syndrome, which is a neuroendocrine response and part of the autonomic nervous system.
Which patient is the most appropriate to assign to an LPN/LVN under the supervision of an RN? 1. A patient with oral cancer who is scheduled for a glossectomy in the morning. 2. An obese patient who has returned from surgery after a vertical banded gastroplasty. 3. A patient with anorexia nervosa who has muscle weakness and decreased urine output. 4. A patient with intermittent nausea and vomiting after chemotherapy. The correct answer is 4. A patient with intermittent nausea and vomiting after chemotherapy. Rationale. Nausea and vomiting are common after chemotherapy. Administration of antiemetics and fluid monitoring can be done by an LPN/LVN. The RN should perform the preoperative teaching for the glossectomy patient. Patients returning from surgery need extensive assessment. The patient with anorexia is showing signs of hypokalemia and is at risk for cardiac dysrhythmias.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The client newly diagnosed with a seizure disorder also has type 2 diabetes. The HCP prescribes phenytoin for the client. Which intervention should the nurse implement? 1. Instruct the client to monitor his or her blood glucose more closely. 2. Explain that the phenytoin will not affect the client's anti-diabetic medication. 3. Discuss the need to discontinue oral hypoglycemic medication and take insulin. 4. Call the HCP to discuss prescribing the phenytoin. The correct answer is 1. Instruct the client to monitor his or her blood glucose more closely. Rationale. Serum glucose must be monitored more closely because phenytoin may inhibit insulin release, thus causing an increase in glucose level. Options 2 is not a true statement. Diazepam may affect the client's anti-diabetic medication. Option 3 is not a true statement. The client can still take oral hypoglycemic medications. The nurse should call and discuss any questionable medication with the HCP, but there is no reason to discuss diazepam, a benzodiazepine being prescribed for a client with type 2 diabetes.
The nurse enters the room of the client diagnosed with congestive heart failure. The client is lying in bed gasping for breath, is cool and clammy, and has buccal cyanosis. Which intervention would the nurse implement first? 1. Sponge the client's forehead. 2. Obtain a pulse oximetry reading. 3. Take the client's vital signs. 4. Assist the client to a sitting position. The correct answer is 4. Assist the client to a sitting position. The nurse must first put the client in a sitting position to decrease the workload of the heart by decreasing venous return and maximizing lung expansion. Then, the nurse could take vital signs and check the pulse oximeter and then sponge the client's forehead. Sponging the client's forehead would be appropriate, but it is not the first intervention. Obtaining a pulse oximeter reading would be appropriate, but it is not the first intervention. Taking the vital signs would be appropriate, but it is not the first intervention. In a question that asks the nurse to set priorities, all the answer options can be appropriate actions by the nurse for a given situation. You should apply some guidelines or principles, such as Maslow's hierarchy of needs, to determine what will give the client the most immediate assistance.
Which task, related to a nasogastric tube, can be delegated to an experienced assistive personnel? 1. Removing the NG tube at the prescribed time. 2. Securing the tape if the patient accidentally dislodges the tube. 3. Disconnecting the suction to allow ambulation to the toilet. 4. Checking the suction after the patient has ambulated. The correct answer is 3. Disconnecting the suction to allow ambulation to the toilet. Rationale. Disconnecting the tube from suction is an appropriate task to delegate, but the nurse must give specific instructions or verify that the AP knows how to do this task. Suction should be reconnected by the nurse so that correct pressure is checked. If the AP is permitted to reconnect the tube, the nurse is still responsible for checking that the pressure setting is correct. During removal of the tube, there is a potential for aspiration, so the nurse should perform this task. If the tube is dislodged, the nurse should recheck placement before it is secured.
The nurse in the emergency department is preparing to administer alteplase to a client whose initial symptoms of a stroke began 2 hours ago. Which interventions should the nurse implement? Select all that apply. 1. Check the client's armband for allergies. 2. Check the results of the client's CT scan of the brain. 3. Teach the client this medication dissolves clots. 4. Dilute the medication with normal saline and administer over 2 minutes. The correct answers are 1. Check the client's armband for allergies, and 2. Check the results of the client's CT scan of the brain. Rationale. The nurse should always check the client's armband prior to administering medication. There are 3 types of strokes: thrombotic, embolic, and hemorrhagic. The nurse must know that the client has not had a hemorrhagic stroke before hanging a medication that destroys clots. Administering alteplase, a thrombolytic medication, to a client who has had a hemorrhagic stroke can result in the client's death. Teaching the client can be done after the medication has been administered. Patient teaching is generally secondary to the immediate, life-saving administration of this time-critical drug. Informed consent is necessary, but detailed teaching can wait until the drug is safely infusing or later, and the patient may be too acutely ill or neurologically impaired to fully grasp the information at the moment of administration.
The nurse and an unlicensed assistive personnel are caring for 4 clients on a telemetry unit. Which nursing task would be best for the nurse to delegate to the UAP? 1. Assist the client to go down to the smoking area for a cigarette. 2. Transport the client to the intensive care unit via a stretcher. 3. Provide the client going home discharge teaching instructions. 4. Help position the client who is having a portable X-ray done. The correct answer is 4. Help position the client who is having a portable X-ray done. The UAP can assist the X-ray technician in positioning the client for the portable X-ray. This does not require clinical judgment. Allowing the UAP to take a client down to smoke is not supportive of the medical treatment regimen that discourages smoking. The client going to the ICU would be unstable, and the nurse should not delegate to a UAP any nursing task that involves an unstable client. The nurse cannot delegate teaching. You must be knowledgeable about the individual state's Nurse Practice Act regarding what a nurse may delegate to unlicensed assistive personnel. Generally, the answer options that require a higher level of knowledge or ability are reserved for licensed staff. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client diagnosed with congestive heart failure is complaining of leg cramps at night. Which nursing interventions should be implemented? 1. Check the client for peripheral edema and make sure the client takes a diuretic early in the day. 2. Monitor the client's potassium level and assess the client's intake of bananas and orange juice. 3. Determine if the client has gained weight and instruct the client to keep the legs elevated. 4. Instruct the client to ambulate frequently and perform calf muscle stretching exercises daily. The correct answer is 2. Monitor the client's potassium level and assess the client's intake of bananas and orange juice. The most probable cause of the leg cramping is potassium excretion as a result of diuretic medication. Bananas and orange juice are foods that are high in potassium. The client with peripheral edema will experience calf tightness but would not have leg cramping, which is the result of low potassium levels. The timing of the diuretic will not change the side effect of leg cramping resulting from low potassium levels. Weight gain is monitored in clients with CHF, and elevating the legs would decrease peripheral edema by increasing the rate of return to the central circulation, but these interventions would not help with leg cramps. Ambulating frequently and performing leg stretching exercises will not be effective in alleviating leg cramps.
An older adult patient tells the home health nurse that he puts 17 grams of polyethylene glycol in a large cup of coffee every morning. Which assessment will the nurse perform first? 1. Assess for signs and symptoms of dehydration or electrolyte imbalances. 2. Assess for signs and symptoms of malnutrition and nutritional deficiencies. 3. Ask the patient to describe frequency and consistency of bowel movements. 4. Ask the patient what he understands about the purpose of the medication. The correct answer is 3. Ask the patient to describe frequency and consistency of bowel movements. Rationale. The patient is taking the recommended dose of polyethylene glycol. Polyethylene glycol is used for the treatment of chronic constipation, so the nurse would assess the effect that the medication is having on bowel movements. Older adult patients generally have a greater risk for dehydration, fluid and electrolyte imbalances, and nutritional deficiencies, so these would be included in routine assessment. Reviewing understanding of medications is always a good idea if the nurse has time.
The nurse is preparing to administer an oral medication to a client diagnosed with a stroke. Which intervention should the nurse implement? Select all that apply. 1. Crush all oral medications and place them in pudding. 2. Elevate the head 30 degrees. 3. Ask the client to swallow a drink of water. 4. Have suction equipment at the bedside. 5. Insert a nasogastric tube to administer medications. The correct answers are 1. Crush all oral medications and place them in pudding, and 3. Ask the client to swallow a drink of water. Rationale. Some medications can be crushed and administered in pudding if the client has difficulty swallowing, but the nurse needs to be aware that enteric-coated or time-release medications should not be crushed. The client's ability to swallow must be assessed before attempting to administer any oral medication. Water is the best fluid to use because it will not damage the lungs if aspirated. The head of the bed should be elevated to 90 degrees when the client is swallowing food or medications. Equipment is usually charged to the client. The nurse should first determine if suction equipment is needed prior to setting it up. The client's medications are being administered orally. Therefore, the nurse should not insert a nasogastric tube.
The 66-year-old male client has his blood pressure checked at a health fair. The BP is 168/98. Which action should the nurse implement first? 1. Recommend that the client have his blood pressure checked in 1 month. 2. Instruct the client to see his healthcare provider as soon as possible. 3. Discuss the importance of eating a low-salt, low-fat, low-cholesterol diet. 4. Explain that this BP is within the normal range for an elderly person. The correct answer is 2. Instruct the client to see his healthcare provider as soon as possible. The diastolic blood pressure should be less than 85 according to the American Heart Association. Therefore, this client should see the healthcare provider. This BP is elevated, and the client should have his BP checked frequently, but not before seeking medical treatment. Teaching is important, but the nurse must first make sure the client sees the healthcare provider for a thorough checkup and antihypertensive medication prescription. Diet alone should not be recommended by the nurse. This is not the normal range for an elderly person's blood pressure. The diastolic should be less than 85. Remember, the question asks which action should be implemented first. Therefore, there is more than one answer that is appropriate, but the first to be implemented should be the one that directly affects the client. The healthcare provider prescribes an ACE inhibitor for the client diagnosed with essential hypertension. Which statement is the most appropriate rationale for administering this medication? 1. ACE inhibitors prevent beta receptor stimulation in the heart. 2. This medication blocks the alpha receptors in the vascular smooth muscle. 3. ACE inhibitors prevent vasoconstriction and sodium and water retention. 4. ACE inhibitors decrease blood pressure by relaxing vascular smooth muscle. The correct answer is 3. ACE inhibitors prevent vasoconstriction and sodium and water retention. Angiotensin-converting enzyme inhibitors prevent the conversion of angiotensin I to angiotensin II, and this, in turn, prevents vasoconstriction and sodium and water retention. Beta-adrenergic blocking agents, not ACE inhibitors, prevent the beta receptor stimulation in the heart, which decreases heart rate and cardiac output. Alpha-adrenergic blockers, not ACE inhibitors, block alpha receptors in the vascular smooth muscle, which decreases vasomotor tone and vasoconstriction. Vasodilators, not ACE inhibitors, reduce blood pressure by relaxing vascular smooth muscle, especially in the arterioles. You can get the NCLEX Mastery Bundle now, link is in the description, or you can get it at alphanurseguide.com.